Hello and welcome to another episode of Discover with Spinati. I'm your host, Dr. Spinati. We are talking about emergencies, specifically related to dental emergencies, and what to do in case you experience them. Before we actually even cover that, we're going to talk about what is a dental emergency and your condition. Is this considered to be a dental emergency? It's important to note the difference between a specific examination, which is an examination of one area of your mouth, versus an actual emergency. That's what we're going to be talking about today. It's going to be a nice, quick, and jolly one, and it's going to be just for you. So pay attention. Episode number 116 today, going strong. So, what is considered dental emergency? There are four things that are considered a dental emergency: pain, which is really obvious, swelling, trauma. So, let's say something hits you, like you get into an accident at work, or you fall on the ground, you break a tooth, whatever it is, some kind of trauma, something that hits, something that causes some kind of disturbance to your oral cavity, to your oral realm or oral environment. And so then that's considered a dental emergency because you need it to be taken care of. Because if you have, your tooth gets, I'm not going to throw any fancy words at you, subluxation, gets luxated and all that stuff. I'm not going to throw that at you. I know I'm not trying to show off. But if your tooth moves, okay, or it's wiggly and you need it to be stabilized, okay, you need to be, as we call it, splinted, then yes, it's definitely a dental emergency because obviously you don't want your tooth to heal in the wrong position. So, or if your tooth actually comes out of your skeleton. What's wrong with me today? If your tooth actually comes out of your mouth, then yes, and what you do is you put it in a glass of milk, or alternatively, you can actually just put it in between your cheek and your gums, like not on the inside where you could swallow it potentially, but on the outside, inside the cheeks, between the cheek and the gums, and that would preserve it until you see the dentist. Obviously, don't eat during that time or don't drink anything during that time. Just go straight to the dentist and go see the dentist so that they can put it right back in and then splint it. Okay, so those are considered, or if you have a swelling, obviously that's a dental emergency, or aesthetic concerns. So let's say, for instance, you chip a front tooth, right? Obviously, you don't look as good as you did before you chipped your tooth. That is considered a dental emergency because socially speaking, you're not going to be comfortable talking to people. And yes, it's definitely considered dental emergency. What is not considered dental emergency is everything other than that. So let's say, for instance, you wake up and you're like, oh, I think my tooth is a little bit sore. Let me go and get it checked out. Okay, that's not a dental emergency. That's considered a specific examination. Still the same amount of time is allotted to it. Still the same kind of steps that are taken in terms of the sequence of the steps, but it's not considered a dental emergency. It's a different code that we use in order for us to charge you. Okay, so this is what is considered dental emergency. Now, what happens at a dental appointment? Before I cover that, I do want to say that if you do experience a dental emergency, let's say you have a swelling or whatnot, and it's after hours, right? Let's say you have a swelling, you don't want to wait. Okay, go straight to the emergency, like in the hospital. Go straight to the emergency so that they can prescribe to you antibiotics so that things don't get worse. But if you don't have a major swelling or there isn't, constant bleeding, then yeah, you can wait until the next day and then see the dentist as soon as possible. Now, if it's an emergency, be prepared to be seen at an inconvenient time. That's something that's common in that, someone calls and they say it's an emergency, but then they start to want to see if they can fit in a certain time. Well, the only reason why we can fit in an emergency is because we're trying to accommodate the person that has the emergency. So we're trying to slot them in between our already scheduled patients. So there isn't this like allotment or freedom for someone with a dental emergency for them to choose what time they want to come in. So do expect, if you have a dental emergency, a true dental emergency, do expect for you to go in during an inconvenient time for you, because obviously it's a dental emergency and your dentist is doing their best to help you out. Okay, so what happens during that appointment? 5 things happen. The first thing is you come in and some questions are asked. What happened? When did it happen? What did you do about it? Are you taking medications? All that stuff. Pain rated from 1 to 10, all that stuff. Okay. Then after the initial, questioning that we do, then we do an examination, right? Then we look inside the mouth, try to see what's going on. Then if we deem it, more than likely, we will deem it to be um, deem it to be an indication for you to have an X-ray. Then we take an X-ray, and then we give you something called a diagnosis. Okay, and diagnosis simply means now this is the problem. Okay, so or we can give you maybe two diagnoses. Okay, or we'll just give you a list of problems in terms of, okay, these are problems that are happening. That's the problem or problems that we're seeing. Now we need to find out whether or not A, you're interested in solving it, and two, how you're going to solve it, because we would give you several options for you to treat it. And that is number 5, okay, which is treatment options. And that's it. Part of the treatment options, by the way, is to get antibiotics if it's warranted. And that's part of it. Okay, so that's it. It's actually very simple. Okay, but obviously it's not as simple as what I just said. Obviously, there's a lot of things involved in it. I tried to simplify it as much as possible, but that is it. That is the dental emergency. It's quick and easy. Wham, bam, thank you, ma'am. And that's it. And you go on, get back to work, and everyone's on to their merry way. More than likely, you're going to be booked back for treatment so that you can continue on. But if the dentist has time to squeeze you in for immediate treatment during that time, the dentist will let you know. Okay, so that's it. If you have a dental emergency, make sure you contact us or visit our website and fill out a form. We'll contact you as soon as possible. Hope you don't experience a dental emergency. But if you do, we're here for you. And as always, keep smiling. Good night.